It might seem like an unusual celebration, but we couldn't let the year anniversary of our health-based place of safety at Oxleas House in Greenwich pass without marking the occasion. We took the opportunity to meet some of the team and find out how the last year has been, starting with Place of Safety Manager Kehinde Johnnson.
My role as the manager for the health-based place of safety is to manage the 136 suite. Yeah, which is is the 2 centralized bed in the 136 suite in Oxleas now. It used to be one in Oxleas House, one over at Green Park's house, but now it's now centralized, 2-bedded 136 suite.
This has been a really a success story, I would say. Before we used to have only 1 suite on this place. Then they renovate it and make it suitable for 2 patients at a time. So we cover the areas like Bromley, Bexley and Greenwich. And even if the patients are picked up anywhere else in the London, they can bring them over if we have the space.
So our role as the place of safety is to ensure that their journey, they have a smooth transition from when they come to the health-based place of safety until when we can put a plan in place. Either they are discharged back to their GP or they are admitted, discharged back to their GP or to a community team who can support them, whether home treatment team or the community mental health services, ICMP, ADAPT. Some are already known already.
We are open to almost everyone who can bring the patient under Section 136 and 135. The difference between 136 and 135 is the patients who picked up from their homes are under Section 135, and they are because the family raised concerns and the community teams involved with them, they arrange assessments and then they bring them over here. And the second source, as we all knew, that is from police. Anyone in the community, in the public place, in the parks, in the hospital, in the town centers, on the street, if they are found behaving bizarrely or strangely or putting their lives at risk, they are picked up by the police under Section 136.
I was talking to people who've been here from the beginning, to someone who's only been here a month, and to hear the sort of the passion that they've got for this, which is a really tough job. These are people in crisis. The police have brought them in for various reasons, thinking they're a danger to themselves or others. There may have been a crisis exacerbated by drink or drugs, some very challenging patients. And they are dealing with them here, and quite often we know that just being here for a while helps them a great deal, because only about half go on to be admitted. So an awful lot of people just benefit from the care they get here.
So I do close one-to-one observations with patients that are brought in under Section 136 and 135, and I take care of them all the time they're here. It can have its challenging moments, but most of the time we get a really good rapport going with the patients and try and make them feel as welcome and comfortable as possible. It's not always possible, but it can be. But no, I really enjoy it.
We can accommodate more patients at a time and work them out whether they need admission or can be discharged in the community. We have got 136 suites all over the city in London. Different trusts have got their own 136 suites. So the more capacity means the more efficiently we can move the patients on.
I've got to thank all our other partners here, Lewisham and Greenwich, who quite clearly we work very closely with our patients going down to their A&E, and of course the police, dealing with people for whom it's not their first job to be dealing with mental health patients, but our relationship with them gets better and better. If things don't work out sometimes, we have a review, we work on it, we see how we can make it better.
As soon as we receive the patient, we identify and take consent from the patient, and we keep the family on board throughout the process. We keep them informed where the patient is right now and where the patient will be going after. And especially if they are going to be discharged, it's very important to keep the family in confidence and take them on board, because they can play a very important role in patient's recovery.
They've done a fantastic job. I was hearing about how there were 496 referrals in this last 1 year and 270 admissions. So about 80% of them had to be sectioned. So this is the kind of patients that you are seeing which have required to be sectioned and to be admitted. But fantastic work also by home treatment team, the other supporting teams, the doctors who turn up in the middle of the night, and the AMS, the assistance from the police. So I think good demonstration of teamwork, fantastic work in very challenging times.
And so now everything comes to here, which means the staff have got much more work to do, but it also means we can develop the expertise. Staff have had to learn an awful lot in this last year they've had. It's been an incredibly busy year, a really steep learning curve for them all. But I think they've done really well. I've been most impressed. The care that they display, I think, is just wonderful. It really is. They really do care about some of the most vulnerable people in our society at some of the most difficult times that they've got.
The first year was certainly a challenge for all involved, and they made sure people who were admitted to the suite were treated with kindness and compassion. In the years ahead, we'll continue to listen and work with our partners and patients.